Tonight, a Mississippi doctor is sharing a story she never expected to tell, her own fight with colorectal cancer. Officials say cases are rising in younger adults, and get this, Mississippi has some of the highest rates in the nation. In my Closing the Gap segment tonight, you will learn why early detection and screening can be the difference between treatment and tragedy. Dr. Manju George spends her days at the University of Mississippi Medical Center, researching ways to increase colorectal cancer screening rates here in Mississippi. But this work is painfully personal.
Cancer was not top of my brain at all. I was thinking, something is going on. And then, at that time, my younger son was 4 and I was busy.
George was diagnosed in 2017 at 44, an age many people don't associate with routine screening. And at first, she says the signs did not feel like a cancer warning.
I had some iron deficiency anemia, and which I thought at that time was because of heavy periods. So I did not, it was not something concerning to me. But what was concerning was I had blood in stool mid-February, and that was concerning. And I went to my primary care doctor.
Her doctor didn't dismiss it. A colonoscopy led to a diagnosis caught early enough to treat.
In 2017, somebody of my age with those symptoms, normally people wouldn't refer them to a surgeon or recommend that they get a colonoscopy. And that's how a lot of young people get diagnosed with later stages. For me, because my primary care doctor was, knowledgeable and she referred me to a surgeon, I was diagnosed within a month since I started having blood in stool. And the stage of my cancer was stage 3B. And at that stage, it is quite curable. Hello?
Now she's urging people not to wait.
So the most important message is listen to your body. If something doesn't seem normal, get it checked out.
In Mississippi, the stakes are high. About 1,700 new cases a year and roughly 630 deaths, according to the State Department of Health. The American Cancer Society warns African Americans are more likely to be diagnosed and more likely to die than most other groups.
It really breaks our heart that Mississippi has the lowest life expectancy in the nation. We also have the highest amount of preventable deaths.
Justin Turner also works at UMMC.
No matter who you are at risk for colon cancer if you have a colon.
He says colorectal cancer happens when cells in the colon or rectum grow out of control, often starting as small non-cancerous growths called polyps. It can be highly treatable and often preventable if found early through screening.
Over the last decade, we have seen the mortality rate in individuals older than 50 drop by 1.5%. So colon cancer death is actually improving in our older population. But in our younger population, we're seeing patients being diagnosed with colon cancer in their 40s, in their 30s, in their 20s.
That's why the guidelines have now shifted. If you're at average risk, screening now starts at 45. And warning signs include blood and stool, unexplained anemia or fatigue, persistent stomach pain, and major changes in bowel habits.
3 out of 4 people that are dying for colon cancer are not up to date on screening. The experts are predicting that approximately 3,900 young folks are going to die for colon cancer this year under the age of 50. Here at the University of Mississippi Medical Center, we don't have to be a part of that statistic.
And the key, doctors say, is getting into a screening pathway.
So we look at the people who typically die from colon cancer. About 75% of them were not up to date with their colonoscopy or their stool-based tests. Now, we want people to get the colonoscopy, but if they don't, the stool-based test is an option. As a matter of fact, the FDA recently approved for a new way to even screen for colon cancer, and that's through blood work. And a lot of patients have no idea about that.
And here in Mississippi, the cost is often the wall that people hit first. Uninsured and underinsured patients may skip annual checkups, delay symptoms, or even avoid screenings altogether because they assume they can't afford it.
Because we don't want patients to think, okay, I don't have insurance, so I'm not going to go to the doctor. And a lot of patients do that. They say, okay, well, yeah, I'm gonna go to the doctor. I don't have insurance.
Now, if cost is a barrier, don't let that be the end of the conversation. Ask about hospital financial assistance programs, sliding scale clinics, community health centers, and lower cost stool based screening options.
You don't have insurance doesn't mean you don't have options. So here at University of Mississippi Medical Center, we have financial assistance programs to assist patients. We have partnerships with FQHCs like Jackson Hines, where our preventive medicine program right now is doing a study with Cologuard with Jackson Hines, where we are assisting. And there's a certain amount of patients who are uninsured who are able to get Cologuard, which is one of those non-invasive tests that we're doing at no cost. So patients can reach out to us, patients can reach out to Jackson Hines or FQHCs because sometimes there's funding out there.
In a state facing some of the highest rates in the nation, one appointment, one test, and one conversation with your doctor could keep a family from becoming part of the statistics. In fact, George has turned her experience into advocacy, hoping to save lives and move Mississippi forward to a future with fewer cancer deaths.
What's so special about colorectal cancer is it's one of those cancers that can be prevented by screening. So any death from it is actually preventable. And that's my goal here, is to increase awareness about colorectal cancer and to get more people screened so that, people don't have to go through that experience that I had to go through.